Hi, I'm Dr. DiLorenzo, and I'm here with Dr. Cynthia Correa Cedeño. She recently opened her own podiatry practice, Orange Sky Podiatry, and I really want to talk to everyone about what to look for with different specialists. So she's going to be sharing some of her pro tips with us on what to look for with foot care. Thank you for being here today.
Thank you for having me.
So
yes, I'm excited.
Thank you.
Nice vibe here.
So I'd like to first ask you, because patients often ask me as family medicine really common foot questions, and I'm not a podiatrist, I'm not an expert in feet. So one of the most common things people ask are, what shoes should I buy?
That's a great question. I'll actually have patients on their first visit bring in their shoes so I can evaluate them. And half of the time, people are wearing the wrong size shoes. So I do measure them. So first start, get the right size shoes, okay? And if someone has, like, let's say a bunion or a hammer toe, which is a little bump on the side of the big toe or on the little toes, get something with a wider shoe box. So something wide, not narrow, because you want to go with the anatomy of the foot. I know that there's so many cute shoes out there that are like pointy and like they got that little end, but that's not the natural anatomy. So you want to go with your natural anatomy. So if you have a foot that's a little bit wider, although you don't have bunions, then find something that fits your anatomy than something that is narrow. That's usually what I suggest. Also a nice arch support too. And if you're someone that your feet feels tired at the end of the day, a nice sneaker shoe with a good cushion, okay, to take off that pressure, especially since most of us are not working on sod or grass. We're working on hardwood floor. So that is a lot of pressure coming back up. That's what I would suggest.
And what about wearing shoes around the house? Because that's something that definitely some patients are like, my orthopedic or specialist told me that I need to wear shoes all the time. I need to wear shoes inside the house, outside the house. So is it, because of the hard floor, we should be wearing a comfortable shoe all the time?
I don't like blanket statements all the time. Everybody is a little different. Everybody has a different foot type. Let's say a diabetic is told to wear shoes most of the time.
Okay.
So it is a protective barrier between them and the floor. Because if they have less sensation on their feet, they might step on something, not know it, and then that can become an infection. But for people that don't have any of that, let's say you're like the healthiest person ever, around the house, it's fine. If you want to walk barefoot for a little bit, it's okay, but you want to be mindful because, again, you have hardwood floors. So that's going to be hard on your feet. That's going to increase straining and inflammation. So I say like a little Birkenstock style of shoe, but it's not bad to walk outside if it's nice and clean on the grass or on the sand, because that is a grounding technique. And that does bring the muscles and blood flows and the nerves to your feet connected all the way up to your body. So that's not bad. Actually, walking on sand is a great way to see if you're someone that could benefit from an orthotic, because what it's doing is it's pushing up your arch, the sand. I love it when patients walk on sand because it really is increasing the blood flow, working out those little muscles, and also increasing that nerve connectivity to the foot.
And I love what you said about the grounding, because I think that's so important, and that's something that we miss out on, those opportunities a lot from a holistic health, wellness perspective, is connecting your body with nature. And so for lifestyle medicine, that's something I definitely teach my patients about, connecting with nature and the outdoors, and especially we have access to the beach here, which is so nice, and the grass, and so I love that.
Orlando, Florida, okay, so not too far. So so it's a great thing, even in the sand. I encourage my patients, even when they walk outside, if you see a patch of grass, walk on it. It's okay, because that's still taking off pressure from your whole entire body structure.
You should just use the grass.
As much as you can. Just watch out for dog poo. That's real. That happened to me this morning, but I dodged it. But other than that, yes, it's really, really good.
Yeah.
Because I've had patients that work from home. My work from home patients, they don't wear shoes the entire time. And then they'll come to me with this like aching and pain. So before giving them any medication, I ask them like, what do you do around the house? I was like, let's just switch it up and let's start using some kind of supportive shoe for like the first half of the day. Does that help, your foot pain? And then they notice that they did. I'm like, okay, then let's do that.
And then you mentioned about the shoes, like getting them a little bit wider. And so say you have like a foot issue on one foot, but you don't have any foot issues on the other, and
Because of a deformity, one foot may be a little bit longer than the other. And the deformity may not just be in the foot, they may have a functional limb length discrepancy. What does that mean? That means one leg is a little bit longer than the other, so you compensate for it. So as long as it's like a half size bigger, that's okay. It's just once you start going like 1 or 2 sizes bigger, you're gonna be swimming in that shoe, and then that's gonna throw off your whole gait. So half a size, maybe 1 size bigger, you can play around with that, but not 2 or 3. She would come in, like it was like wearing a size 8. I'm like, mm-mm. Then I measured her 5.5. So, okay.
Wow.
Okay. Yeah, so those numbers are important to know. But half a size bigger or a 1 size bigger, okay. That's fine.
And then say we don't have access to someone as amazing as you for measuring our feet. What's another option that people have? I mean, are there stores that really measure anymore?
I should look more into that. I think they might. What you can do is when you try on your shoes, I know that people do the thumb test, okay? So you can do, so if you put a whole, okay, so I'm putting 2 fingers behind, all right, that's fine. It's nice and snug. That's okay. But if you're putting 2 fingers on the back of the shoe and it's wiggling in there's a lot of space, that's probably 1 or 2 sizes too big.
Okay.
Okay. I know that patients like to do the pushing down on the big toe. That's fine as well. Okay. You just don't want to have like 2 fingers too big. So 1 finger, 1 thumb is okay. 2 too many.
Okay, good. That's how I usually check for my kids.
Yeah. But this is like 3 centimeters or something.
Yeah.
But we can do that. You can ask the store. A lot of them do. I know I've gone to DSW and they measure you. I've gone to the New Balance stores and they measure you. You just have to ask.
Okay.
Yeah.
And then we have a lot of pregnant patients who complain about foot pain, back pain, so is it coming from the back? Is it coming from the foot? Is it coming kind of from everywhere? Are there certain things in pregnancy you can or cannot do with your feet, or should wear sneakers kind of more often as well to help support your feet?
Yes, so I definitely recommend a supportive sneaker shoe. With a couple of my pregnant patients, actually even one of my cousins, I recommended a custom orthotic because her heel was constantly hurting her. Although she changed shoes and bought more comfortable shoes, she needed the orthotic. What it did is like an eye prescription. So it put her foot in a functional position. So now when she's walking, it's not straining her foot and causing all this inflammation. And then she was putting on like topical lidocaine, and I'm like, let's figure it out. So we changed out her shoes, did a 3D scan, sent it off to a 3D printer, and put that in her shoes. And then that helped her for the rest of her pregnancy. I also recommended her husband massage her foot and do little foot mobilization because that helps with any adherence in the area, like just like the little fascia, like just how you get massages in your neck. You can do that in the foot, and all of that helped her. If the swelling that they have is too much, I suggest some compression stockings, and they don't need to be the beige ones. You can have fun and put some stars on it, or if you like whatever you like, you can get it. And that's what she did. You want to wear hot pink? Wear hot pink. And that helps with the circulation of the foot. And it helped with her pain a lot.
And then for people who are on their feet all day, I definitely recommend them wearing compression stockings as well. When I'm working at the hospital, I'm always wearing my compression stockings of like every different color, for sure.
And make it fun, because I would have a complaint, especially women, like, oh, they're boring looking. Well, then don't make it boring looking. Just find something fun, a colorful one, and some kind of, I don't know, brings you joy.
I love that. Okay, and so if you could give everybody your pro tip, like your number one thing that you talk to with patients about foot care and podiatry, what would you tell?
Yes. So the thing that I say is, since I'm more holistic and preventative medicine, I say really listen to your body, but also listen to your feet. They talk to you, and you feel it throughout the day, especially people who are working all day. Your feet feel tired. There's like a burning sensation. They feel tight, okay? That's usually some overwhelming inflammation going on with the foot, and something is off. So when that is happening, say that as an oil check, like in your car. You want to get that check, because if you don't get that oil check, what happens? The transmission goes, you got to get a whole new car. Unfortunately, you can't do that with your feet. I have had patients ask me, can you get a foot transplant? I'm like, no. That's some Marvel movie stuff. Like, it doesn't work. So what I say is, like, just do the check-ins. If your feet are feeling tired at the end of the day, you're feeling some burning sensation, you're seeing like a little bit of swelling, something just feels off, something is kind of like, you feel like, why do I have this pain and it doesn't go away after 2 weeks? I would say go to a specialist, because at that point we can do something to help you and give you health and longevity to your feet, So you're not coming to us at 80 years old all hobbling. I'm like, I want to give you that time. I want your feet to withstand all those years and you have fun. I want you to hop out of bed, do a little dance, and start your day. Yeah.
And one pro tip I just want to add as a family physician is look at everyone's feet. So if you are a patient seeing your doctor for a physical exam, you know, we do head to toe physical exams and sometimes we get distracted and we might not check the feet. Ask your doctor, please just take a look at my feet. Most people will have occasional pain and things, but maybe there's something there that functionally you can do something about and be referred to, or, you know, just do some massage or, you know, just depend more holistic techniques and things. So, and yeah, just advocate for yourself.
Yes.
So thanks so much for joining us today.
Lots of fun.
And take care.
Here, bye.